Hi, this is Lydia. I'm going to be talking today about accessibility within the mental health system. I chose this for what I wanted to talk about because I really think that this is where a lot of the problems and issues, as far as the mental health system goes, stem from. And if one is not able to access services like mental health services and whatnot, there is really no point for them, so to speak. So moving on from that, just to kind of describe what accessibility means in terms of what we're talking about here, within the mental health system, um, we're really talking about how an individual can access the services needed um, that they require in terms of mental health or mental treatment, specifically talking about how individuals must qualify to access certain services like insurance and whether or not they have a certain amount of income to cover costs of what that type of treatment that they need could be. Their access to treatment, whether or not they can get to and from a place to get treatment, if there is a place close to them that is treating what it is that they need, etc. We're also going to talk about how accessibility can be or the quality and cost of insurance can be an underlying issue of how a patient may access certain types of mental health therapies or treatments. So if the quality of someone's health insurance is inadequate, and most places or providers will not take that type of health insurance because the payout on their end just isn't there, that can also be an issue because most low income people will not have great insurances or insurance policies that most people will accept. So, we're also talking about access to special education, using inner city education and lower income education as an example here. You're not always going to have that special education there for you if your child or you have not been identified as needing that type of special education. And some schools can fail in recognizing a child's needs for that type of help. Um, and also, workforce availability. Um, Unemployment is a huge issue, especially nowadays. If someone, isn't working, they don't have benefits, they're not going to get that health insurance that's going to cover them for this type of treatment, which is extremely expensive if they were to pay out of pocket, excuse me. And a question that we want to ask ourselves are, can those who need this type of treatment most readily access this mental health care system as well as they can? And the people who we're talking about who really do need this most and who tend to suffer the most from mental health issues or mental health diseases are those coming from low income families or poor areas, minorities, the disabled, people who are disabled, senior citizens, veterans, those who suffer from PTSD have extreme mental health treatment and therapy needs, and those cannot always be met. So we want to ask ourselves, why are there such issues surrounding accessibility within the mental health system? And like we talked about, I'm going to expand access to insurance. To get health insurance, especially in America, is extremely difficult. If you want to get good health insurance, you have to have a full-time job with benefits. You have to have been working there for X amount of time, and you get a somewhat adequate or more than adequate health insurance coverage provider that you more than likely will find a lot of doctors, primary care physicians, psychologists, psychotherapists that will accept that type of coverage. However, if you're not getting that type of insurance, if you're getting Mass Health, for example, or a lower quality health insurance or a lower quality of coverage, they're not going to cover these types of treatments. And a lot of these places that you're going to want to go are not going to accept that type of insurance, and you just can't be seen there. And that's the type of issue that we're dealing with today, is you're getting turned down really because you don't have the right type of health insurance. You don't have the right type of payout or company that will pay the rest of your bill, so to speak, that company is really looking for in that quality insurance. Access to treatment. Are they able to readily access somewhere that offers the type of treatment they need? Who is taking/seeing new clients? A lot of issues that we are having today in the mental health system is that there are not enough people working within this type of health department, agency, whatever you want to call it. And so there's not a lot of people who are seeing new clients because they are so overrun with patients, clients already. They just can't take any more. So someone who needs to see a new psychologist, who needs to get on medication, who is unwell, is going to have a really hard time finding someone who is A, taking and seeing new clients, B, accepting their type of insurance, and C, that they can afford. Is it around them? Are they able to get there? Do they have proper transportation, like the disabled or veterans who are disabled? They can't always, get around as easily as everyone else. So that's always a question. Can they really access that type of treatment or therapy? Quality and cost of insurance, again, so your type of insurance policy and holder, who will take this type of insurance, access to special education, ability to access additional services when appropriate. Excuse me. Again, so, with rural areas, kids in urban, higher population areas aren't always going to get that type of recognition or attention that they need, where, in suburban areas, better school systems, so to speak, they'll have more individuals working with special education, more individuals looking for those students who do need the extra help and offering it to them. So there's just not a whole lot of it in those other areas, the lower, the poorer areas, because there's not enough teachers, and there's not enough people there who are actually recognizing and paying special attention to those kids who need more help and who need the special education extra help. So workforce availability, kind of going with that, you need enough staffing professionals in that field, widespread. We need more people in the mental health system. We need more people working as psychologists, psychiatrists, people who are well educated in mental health, who can help more people in America today who need it. So I'm going to include a couple of quotes here that I thought were interesting. Some of them have statistics in them. So some of these issues highlighted in high cost and insufficient insurance coverage. So this quote states that the NCBH survey, which is the National Council of Behavioral Health, confirms these findings, revealing that 42% of patients see high costs and limited insurance coverage as their main barriers to accessing mental health care. As patients face limited options for in-network mental health care, they either face large medical bills or are unable to visit a medical professional at all. So this was noted on this website in this survey that a large percent of patients are viewing the insufficient insurance coverage as a huge issue and a barrier to them getting mental health care or proper mental health care. And here's another one. 42% of the population saw cost and poor insurance coverage as the top barriers for accessing mental health care. 1 in 4, so 25% of Americans reported having to choose between getting mental health treatment and paying for daily necessities. So that is right there a huge red light indicator that accessibility for mental health care at this point just is not where it needs to be. So limited options and long waits. So access to face-to-face services is a higher priority for Americans seeking mental health treatment than access to medication. 96 million Americans, or 38%, have had to wait longer than 1 week for mental health treatments, and nearly half of Americans, or 46%, have had to or know someone who has had to drive more than an hour round trip to seek treatment. So this is what I was talking about before. There's not really anything close to some people where they can seek treatment, and to those who are starting to seek treatment and looking into options for themselves, it really takes a while to get everything into place here. I mean, if you are in an emergent situation and you need to find something fast, it is just not going to happen sometimes because it takes a very long time to set something up, set up an appointment, see a doctor, unless you go into the emergency room and pay those types of fees. I mean, you're just not going to get prompt to treatment. And a lot of these quotes that I am talking about here were on that website for the National Council for Behavioral Health. I am also having some quotes here, as I footnoted with proper citation, some quotes from Patient Engagement HIT, which is a website on how patients engage with medical professionals. So moving on, lack of awareness. While most Americans do try to seek out treatment, there also is a large portion of the population who have wanted to but did not seek treatment for themselves or loved ones. So this is 29%, in part due to not knowing where to go if they needed this service. What's more, 53 million American adults, 21%, have wanted to see a professional but were unable to for reasons outside of their control. So there's a lot of Americans today who just don't know that there are doctors out there that can help them for certain issues, who they're supposed to call, where they can get certain information. There's just a lot of lack of awareness there. And like mentioned in recent discussions that we've had, there is a huge social stigma around mental health. Quoting here, nearly 1/3 of Americans, or 31%, have worried about others judging them when they told them they have sought mental health services, and over 1/5 of the population, or 21%, have even lied to avoid telling people they were seeking mental health services. This stigma is particularly true for younger Americans, who are more likely to worry about others judging them when they say they have sought mental health services. So these statistics here are really kind of shocking, that many people would rather not seek out mental health treatment or mental health services just because they don't want people to find out, or they are worrying about what people think of them. I find that to be shocking, personally. So here are just some more statistics here that you're more than welcome to read through. The demand for mental health services is stronger than ever, with nearly 6 in 10, so 56% of Americans seeking or wanting to seek mental health services either for themselves or for a loved one. The inadequate access on a state level states that at the 2018 Cohen Veterans Care Summit in Washington, D.C., the study, which assesses Americans' current access to and attitude towards mental health services, revealed American mental health services are insufficient, and despite high demand, the root of the problem is lack of access or the ability to find care. So that right there just sums it up, that the lack of access in the mental health system is really the root of all of these problems. Most Americans do not have sufficient health insurance coverage, again, that being one of, if not the biggest issue around this gigantic issue itself, quoting that nearly 1 in 5 Americans, or 17%, were noted that they have had to choose between getting treatment for a physical health condition and a mental health condition due to their insurance policy. The majority, 64% of Americans who have sought treatment, believe the U.S. government needs to do more to improve mental health services. Hallelujah. Many people do not have health care readily available mental in close proximity. 2018 survey, again, from the National Council of Behavioral Health, showed that 56% of patients want to access a mental health care provider, but many face care barriers. So people are out there, they want help, but they just can't get it because they have these types of barriers that we just discussed about in their way. So what I'm going to talk about here are recommendations, or what could we do or for the mental health system to move forward or to help these changes not be as bad. So below are my recommendations to help bridge the accessibility gap in the mental health industry. I'm suggesting to support innovative solutions that improve access to mental health care, allocate more government spending for no-cost mental health services, understand gaps in the workforce, identify problems and solutions in rural areas such as transportation, and considering alternatives such as virtual sessions, maybe providing them with the technology for that, because I know there's a lot of low-income issues there. And for the understanding gaps in the workforce, I think that the government as a whole can really try and spread out medical professionals a little bit more, maybe try and get more mental health medical professionals on board and such. And so I just wanted to end this presentation here with something to think about. So despite this strong demand for mental health services that we have, and we're always talking about in current times today, common barriers still remain, the biggest being accessibility, like we've talked about all along here. So before we can even begin to address the issues within the mental health system, we really must first have a system that grants access to those who need it most, like we talked about, the low-income families, minorities, those with disabilities, veterans, those who really need it most, and those who really suffer from these mental health issues the most. If we cannot ensure access to basic mental health services to those who need it most desperately, then the system really just has failed. Most significantly, this high cost and insufficient insurance remains to be the most significant barrier for many to receive health care, and it's really, really upsetting, along with limited options, long waits, and stigmatization. I personally advocate for no-cost and remote mental health sessions, as well as additional government funding toward healthcare staff and centers to service those in need. The U.S. needs to intervene and allocate more time and resources to addressing the mental health crisis in the U.S. before it really is too late. And here are my sources that I used for this project, and I hope you enjoyed it. Thank you so much.